presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, South Florida, and all our listeners throughout the whole country. We hit about 3 million people in the course of the week, so we have a very, very interesting show. All counties presenting a very, very interesting show. Last week, we talked about telemedicine. We showed you what telemedicine, basically the right way to do telemedicine and telehealth. Tonight, I have with me a guest. I have Ed Salazar, the Vice President of American Telemedicine. What is American Telemedicine? That's what we'll ask ourselves. American Telemedicine today is the most up-to-date response system, also a telehealth product that when your doctor calls you, you will have an up-to-date response of what your total vital signs. As you know, when you get a telehealth visit, and I'm sure a lot of you have had a telehealth visit recently, what does a telehealth visit do? Ed will tell you. A telehealth visit, basically, the doctor starts off, Lou, how you feeling? Ed, how you feeling? Oh, I'm feeling good. Oh, you're feeling good? That's great. And he talks to you like 20 minutes like you're on the golf course about everything else. Then after the 20 minutes, he says, thanks, Lou. Have a good day, and eventually we'll get to see you in the office. And he goes and bills Medicare. Well, guess what? I'm not a doctor. I can't examine myself, so I could drop dead in the next 20 minutes because he doesn't know my vital signs. He doesn't know basically my oxygen level, which is very important today with COVID. He doesn't know my temperature. He doesn't triage me. You know, when you all go to the doctor's office, and I just was there recently, what's the first thing she does? Takes your temperature, takes your blood pressure, takes your heart rate, takes your oximeter. She takes everything she needs to know, records it, so when a doctor comes in, he says, well, Lou, your blood pressure's normal, everything's good. He's got a complete triage. That's what American Telemedicine does with telehealth. Now, Ed, you now installed American Telemedicine with a couple of our patients. At All County Healthcare, we give the patients our telemedicine, telehealth product for zero. For zero. That means if a patient needs to be seen by a doctor, he has a big ability. And recently, you just installed a couple of our telehealth products in the family's home, correct?
That's right.
And one of the sons were there, right? Now, what did the son ask you?
Well, the son was there, and I was going over the different features of the program.
Right.
And when I got to the fall detection, he said, wait a minute, are you telling me that your little device also does fall detection? I said, yes, it does, and it has an integrated GPS. And he said, well, how much do you charge for this? And I told him, you know, if you were handling this yourself, then you would be paying a subscription fee, a monitoring fee of $49 a month.
That's correct.
And he looked at me and he says, well, we just got a quote from ADT, and they want $60 a month just for fall detection. So the fact that, you know, we offered the fall detection plus monitoring all these other parameters, he was thrilled.
And let's explain how it works. The way it works is basically is that we supply you with all the necessary FDA-approved equipment, like the blood pressure cuff. Every morning you'll take your blood pressure. Every morning you'll take your oximeter. Every morning if you've got diabetes, you'll take your glucose. Every morning you'll take your temperature. And if you have heart problems, you'll take an EKG every morning. You'll also get, well, guess what? We give you a free scale, which is Bluetooth, which is recorded. Now, how does that work? Very simple. All these devices are Bluetooth, what we call paired. Where are they paired to? The famous, what we call a little
The pendant,
which is the Link Plus. The Link Plus is the key to everything. The Link Plus basically has your home care company on it. It can have your daughter can call you on it. Your doctor can call you on it. You leave the home. You take it off the hand, you take it off the thing. You wear it as a bracelet or a necklace. You carry it with you. And guess what? You're going shopping. Your daughter says, Ma, where are you? She calls you on the Link Plus. She knows exactly where you are. The GPS tells her where you are. Now, if you don't want to basically do all this, your daughter now can what we call control the portal. This Link Plus takes all the information, it's transferred into the Link Plus, what transfers it to the portal. What is a portal? A portal could be your daughter's laptop, her computer, or her iPhone. Once she controls the portal, she knows everything about you. She knows what your temperature is every morning. So in case you say, gee, I'm not feeling well, then guess what? We can make sure the doctor talks to you and he get access to your portal. And when he does a visit with you, he has an up-to-date report of what? Of your blood pressure, of your oximeter, of your glucose, your temperature. So he's really doing a complete triage, and now he can do a bona fide telemedicine visit. And every minute he's talking to you, that's recorded. So if Medicare said, you really talk to that? Yes, here it is. It's all recorded. So the doctor now has a complete recording of everything he's done with you. Now, there's a right way to do telehealth, and there's a wrong way to do telehealth. I always say to people, you always had a telehealth visit. And since the COVID, Medicare is sort of, I guess, what you call, got a little lazy, and they allowed the doctors to do it on their iPhone, their iPad, and their computer. Doctors love to do that. It's very simple for them. They have no liability. They're saying, okay, I'm giving you a telehealth visit. They bill Medicare for full office visit. I don't think it's fair to the consumer. I think we as the patient have a right to know what a real telehealth visit is. So if I'm going to go, I've talked to doctors, they love our program. And guess what? We designed it for physicians. If physicians now decide that they want to do this because you have a few modalities like high blood pressure, you have diabetes, you have a few heart problems, and isn't it true that the doctor now can bill Medicare, what we call remote patient monitoring now?
Yes, Medicare and Medicaid both have been coming out with new codes all the time.
Please connect your Link Plus to your charger.
Okay, so with that telling us connect it to the charger. Okay, this will stay charged for 24 hours. Now, Ed, what does that mean? That means that the doctor can do what we call remote patient monitoring. He gives you all this equipment. You now take your temperature every morning. It doesn't have to be every morning. Your glucose reading, your oximeter reading, whatever you want. It goes right into the doctor's portal. Now the doctor now can see you. If something's drastically happened, a red flag comes up and notifies the doctor that, wait a minute, Mrs. Jones's blood pressure's out of whack. Her oximeter reading is very low. I better give her a call. So he'll call you and he'll say, wait a minute, have you done this? Have you done that? I want to see you in the office. So he's 3 steps ahead of everybody, knowing that something happened to you, where if you didn't have this equipment, he'd have no idea what you'd have to call 911. You don't want to call 911. You want to basically know what's wrong. So the doctor now can do a telemedicine visit over this little device, okay, which you call a Link Plus. The Link Plus is the key thing. Now, it took us 3 to 4 years to develop this thing to where it is today. In multi-millions worth of dollars, a lot of millions of dollars. This has been all done programmed. Guess what? This is HIPAA approved. It's FDA approved. Is my cell phone HIPAA approved? No. Is my computer HIPAA approved? No. Is my iPad HIPAA approved? No. What does that mean? That means somebody can hack and get in and know all your information. They can't basically get in and hack this. It's very difficult. Anything can be hacked, but this is almost impossibly hacked. Now, there's a little red button here. In case you need emergency during the night, what happens is you press that red button, and we have a 24/7 call center. Goes right to the call center. The call center now will call you and say, hey, Ed, Lou, are you all right? Is this an emergency? Yes, I need an ambulance. They dispatch an ambulance to your house. At that point, now your doctor can be notified, your daughter will notify, anybody can be notified of where you are. All right? So when you're looking at all this equipment, what I like to say is, would I rather have something that's HIPAA and FDA approved? Because Medicare right now, also, if you're on Medicare Advantage plans, that's the Advantage plan that we call Medicare Advantage. That's the Humana, the Aetnas of the world, not the straight Medicare, where people are telling you, yeah, you'll see Joe Namath advertising Medicare Advantage. You'll see the Hamilton advertising Medicare Advantage. You'll see all these athletes saying, listen, call us now. Check your Medicare. Medicare Advantage, you might get a home health aid, you might get food, you might get this, you might get that. The only thing you're not going to get is care. You'll get everything good, but you won't get the care that you need. Because Medicare has been in existence, and why is everybody concerned? Right now, we're going to a political season. One saying you're going to get rid of your Medicare, one saying we're keeping your Medicare. Seniors want Medicare, and they want Social Security. Medicare has been in existence, started by John Kennedy when he first put Medicare in many, many years ago. And he said, when you're 65 or older, guess what? You're allowed to get Medicare. All right? What has happened during the years, it's changed. All right, they came up with programs called Medicare Advantage. Well, I'm not knocking Advantage plans, but I always call it Medicare Disadvantage, being in healthcare 30 years. Because if you I just had a friend of mine who switched from Medicare Advantage to straight Medicare because he realized that every time he was going to the doctor, he was paying $70, $80 copays. With Medicare, you don't have a copay. You buy a supplemental, depending upon what you want to buy, with small deductible, large deductible, your supplemental will be paid for. But Medicare will pay the physician to monitor you X amount of dollars a month. It can come out to like $168 a month if he spends with you 30 days a month and he's monitoring you every month. Why? We don't want you in the hospital. Medicare does not want you in the hospital. So I have one question. If you're going to sea and you're going to get on a small boat, or you're going fishing, or a boat, what's the first thing you're going to put on? Ed, what are you going to put on?
Life jacket.
You're going to put on a life preserver. Well, guess what? What do you have now at home to preserve your life when you're left alone? You have absolutely nothing. You have a phone, a cell phone. How do you get to the cell phone? All right? But Live Care, the Link Plus, is your life preserver. All right? Is your life preserver. That means it can save your life. It can get a hold of your doctor. It can all do these extra things. We have written a number of articles. One's going to be going in the hospital news this week about what is true telehealth. We getting a break here? Excuse me. I think we're ready for break. Our sponsors tell us, please take a break so our sponsor can at least come on and give us a little plug for the sponsor.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life for patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy. Please call All County Healthcare for more information about this FDA-approved
For
therapy.
further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Patients first. We do pay patients first. We're the only company right now that has what we call IPV that treats COPD. Now, any people out there have COPD, guess what? American Telemedicine is going to assist you. Our IPV treatment is going to assist you, which Ed is a renowned a respiratory therapist for over 40 years. He'll tell you about IPV. He'll tell you how American Telemedicine is going to help you. Remember, if you want to know more about American Telemedicine, please call 561-278-2222. Very easy number to remember, 561-278-2222. Now, are we going to leave you stranded with American Telemedicine when we send you all this stuff? No, that's when Ed's going to come over and assist you, and Ed, tell them how you assist the patients when you put this and bring it to their home with the nurse.
Well, what we'll do is we'll explain, in detail how the equipment works and how to be sure that they're getting the most accurate measurements, and to be certain that once the measurement's taken, that the upload goes to the cloud. Everything will be on the portal, and one of the unique things about our platform is that not only can the physician access the portal, but as you mentioned earlier, a family member can as well, and that gives them great peace of mind.
Right.
You call your mother and you say, "Well, how are you feeling today? How was your blood pressure?" Well, you can take a look and you can see for yourself.
Now, Ed, can a family member control the portal for the mother if she doesn't want to do it?
Yes.
Okay.
Yes.
So what Ed is saying is, if you have an elderly parent and they have a home health day, say 4 hours a day, this is another thing we designed. We designed this originally was designed to bring the emergency response system into the 21st century. Because what is happening, that IFL can't get up device, all it does is they send you EMT. If you're not home, there goes the door, there goes the window, they got to get in the house. And if you are home, you're going to the hospital, you're going to get a copay, you're going to get a bill, you're going to get a bill for whatever you got. Our system basically allows you to speak to your physician, to speak to your daughter. Now, Ed, when I'm saying the portal, what we're saying the Link Plus is the hub. Am I correct, Ed?
Yep.
Everything goes into the Link Plus, into the hub. Okay? The hub now transfers it to the portal. Is the portal what? It could be a laptop. It could be an iPhone, Ed?
You can view the information on the portal from a smartphone. You can, any kind of a computer. There are a lot of options.
All right. So what Ed is saying to you is that all this information is stored. It's stored into the portal. Am I correct?
Yes.
So if the doctor wants to go back and see what you were 2 months ago, he can he?
Yes.
3 months ago, he can. Can he, let's say, for instance, he wants to do a telemedicine visit right now. If he calls and looks into the portal, can he see your vital signs right away?
Yes, he can. He'll see whatever the most recent measurement was.
So if you took the vital signs in the morning, he could see it. If he says, let's take your vital signs again, he can view it. He can see what it is.
Also in the portal, he can scroll down and he will find bar graphs and charts, pie charts, so that at a glance he can see what's been going on for the past 30 days, 60 days, 90 days, whatever cycle he wants to look at.
So I want you to ask yourself, Ed, we've done a lot of these things at all county healthcare, why we're advanced. Listen, we all need patients. We all need to take care of patients. Nursing homes look for patients. Doctors look for patients. It's all marketing, right? It's all trying to get you the best. We don't look at it as we need patients. What we want to do is we want to make you the patient first. You're the person that counts to us. We don't say to our nurse, do 3 visits, 4 visits, 5 visits. We say to our nurse, do as many visits as that patient needs. We make sure the patient is happy. We contact the patient. If it's IPV, interpulmonary respiratory, Ed, what does IPV do?
Okay, IPV is the acronym for intrapulmonary percussive ventilation. And what it is, it's a therapy. It's a percussive therapy that helps the patient mobilize secretions. The biggest problem, the number one problem, the reason COPD patients, high acuity COPD patients exacerbate is they simply cannot cough effectively. And that's what we do with this therapy.
Now, is that IPV therapy similar to what they're going to get in a hospital if they go to hospital?
Some hospitals, yes, but not all.
Okay. So what you're saying, some hospitals have they could treat IPV, they could treat respiratory disorders, right? They could treat COPD.
Yes.
Then they send them home. And usually what happens with COPD, they're frequent flyers to the hospital, aren't they?
Yes, it's one of the most common causes for readmission to a hospital is exacerbation of COPD.
Okay, so with the IPV treatment, all counties have done studies, right, Ed?
Yes, we have.
And how long have we kept them out of the hospital?
The national average for readmission is about within a 15-day period, approximately 1 in 5 patients will come back to the emergency room.
Okay,
with all county health care, we have less than a 5% readmission rate over a 12-month period.
Listen to what he just said. 1 in 5 patients within 15 days are back into the emergency room. Now, we know people in facilities that go to the hospital with COPD. Now, what have we done? We're the only company that's invested over $100,000 into units that treat COPD, which we don't get paid for. We get paid for the nursing. So what I'm saying to you is, are we ahead of everyone else? Ed now went to a lot of companies, and we were the only company to purchase it. Am I correct, Ed?
That's right. All the companies thought it was a good idea until we got to the acquisition cost. And once they heard the acquisition cost, then it wasn't such a good idea.
Okay, so the next question is, how does COPD work with American Telemedicine?
One of the other real nice features of our platform is that each patient has what's called a threshold. A saturation point for a normal person, might be 94, 95. If it drops below that, the doctor wants to know.
You're talking about this oximeter reading, am I correct?
Pulse oximeter.
This is a pulse oximeter.
That's what measures your blood oxygen saturation level.
Right. So if we did this right now, Ed, we checked our blood oximeter. This is recorded in the Link Plus. Am I correct?
That's correct.
Okay. So this goes into the Link Plus right now, and this will tell you what your oxygen level is and what your heart rate is. Okay. So the next situation is we have 3 minutes, and they're telling me they give me the 3-minute sign, 2-minute sign, 1-minute sign. Well, we're going to take longer because I think this is important. All right. What's important about it is that you have today during COVID, the 3 things that the patient should be concerned about is his oximeter reading, his temperature, heart rate, and his basically
blood pressure.
His blood pressure. If he sees his oximeter going down below 80, 70, 80, he's in trouble.
Very much so.
All right, so he has to get into the hospital right away. Chances he's going to be put on a ventilator. So guess what? This costs you $69 at Walgreens. This might cost you another $30 or $40. We give you all of this equipment for only $49. So why for $49 wouldn't you want something to preserve your life? I want to thank everybody for listening tonight. If you have any questions, you can call us at All County Healthcare at 954-717-7027. That's 954-717-7027. You can call Ed or me at American Telemedicine at 561-278-2222. We will mail you out information. We have tons of information. Tons of letters, and guess what? If you were on home care for 2 to 4 hours a day, 6 hours a day, 10 hours a day, make sure you have American Telemedicine by your bedside, because that's your life preserver when that aide leaves. Call us at 561-278-2222. I'm not getting off the air. I'm going to keep talking because I like this. All right? Because you took too much of time with the other guy. But that's okay. We're going to get off the air now. Thanks again. Thanks a million. Have a wonderful evening. Great talking to you about American Telemedicine.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.